Welcome back to the second part of Chapter 3, and we're discussing terms related to the whole body. We are on terms related to the anatomic directions, positions, and planes. And I know sometimes this gets a little confusing for people, but very important to get a good understanding of these terms. And terms in this table are grouped by opposite meaning, so I'm just going to pronounce the term and then you study the meaning. So we'll begin with the first term, cephalad, caudad, superior, inferior, anterior, posterior, ventral, dorsal, lateral, medial, unilateral, bilateral, proximal, distal, superficial, deep, and anteroposterior. This table continues that we need to become familiar with: anatomic position, decubitus, dorsal recumbent, Fowler position, semi-recumbent, lateral recumbent, prone, and supine. When we look at the body planes, we need to understand the term plane, frontal plane, coronal plane, sagittal plane, and transverse plane. This diagram shows us directional terms that describe the location of body parts in relationship to another. So we can see the right and the left, the proximal and the distal, the lateral and the medial, the deep and the superficial, the proximal and the distal on both the arm and the leg. Superior, inferior, we see the cephalad and the caudad, and the anterior ventral and the posterior or dorsal. The anatomic position is the body in its standard reference position, standing erect, arms at the sides, and palms facing forward. This diagram shows us the body planes divided, the body planes that divide the body into halves in different ways for reference purposes. So the frontal or the coronal plane divides the body into anterior and posterior halves, and the sagittal plane divides the body into left and right halves, and the transverse plane divides the body into upper, superior, and lower or inferior halves. When a good study tip when you're thinking about planes of the body is think of planes as an invisible flat surface dividing parts of the body, like this picture. I really like this picture for that reason. So the frontal and the sagittal planes are positioned in a vertical or up and down direction in relation to the body or parts of the body, whereas the transverse planes runs in a horizontal direction across the body. This table, what we're doing is we're moving on to colors. So very important. These become easy once you memorize the colors. So many word parts indicate colors. For example, an erythrocyte is another term for a red blood cell, and this term is derived from the word parts erythro for red and cyte for cell. So this table lists some of the most common combining forms related to colors. So chloro for green, chromo for color, cyano for blue, erythro for red, leuco for white, melano or melano for black or dark, and xantho for yellow. Chloroma, these are terms related to colors, and you can see how the color is in the definition or the meaning of the term. So chloroma and chromaturia, cyanosis, erythrocyte, leukocyte, melanoma, and xanthroderma. This next section of the chapter talks about medical records. And in healthcare settings, medical terminology is used in both spoken and written communication. But the primary form of written communication is the patient's medical record. And because you're likely to encounter different types of medical records in your work, later chapters in this text frequently include medical records, and in each weekly module I'm including sample medical records for you to read. This will allow you to become familiar with the different formats and experience some real-life uses of medical terminology. So let's talk about the common types of medical records. So hospital and clinical records, sometimes these are simply called the patient's record, typically are a collection of all the written documents related to the patient's examination, diagnosis, and care. Another type of medical record is the H&P, or the history and physical examinations, and that's a record of the patient's medical history. And this might include forms the patient fills out and the healthcare provider's examination of the patient. And this is usually a standardized report because the examination is performed in a standard systematic manner. Consent forms. These forms are signed by the patient to give permission for health care to be provided, and the forms might include special forms for surgery or other procedures. Healthcare provider patient care notes. These are written in the patient record whenever a physician, nurse, dietitian, pharmacist, physical therapist, or any other healthcare provider gives the patient any form of care. And generally it's their note, and the healthcare provider is documenting all the diagnostic treatments and procedures along with observations, test results, and consultations with other specialists. Laboratory and diagnostic test reports, and these may come from sources outside the primary care team, such as blood test results from an outside lab or a pathology report, or from another department within the healthcare facility. And then there might be other specialty reports, and these might be reports from other caregivers, including, and this sometimes crosses over with the healthcare provider patient care notes, but this might be the anesthesiologist report during surgery, discharge reports when the patient leaves the hospital. So be sure to, I'm going to go back to that slide real quick. So be sure to practice reading the medical records. And when I give you the medical records in the weekly modules, or if you read the medical records at the end of the chapters, just read them through for the first time. Don't stop to puzzle out every new term you encounter. Instead, just read it all the way through, get a general sense of its meaning, and you will find it easier to understand specific terms once you're familiar with the overall context of what the medical record is talking about. And then if you're unsure of some of the terms, pull out your book or medical dictionary and look them up. The rest of the chapter, or the chapters in this text, are going to be an introduction to body systems. So a body system is a group of organs with related functions, can be called an organ system. So for example, the respiratory system includes the lungs and all the air passages from the nose and the mouth to the lungs. And the primary function of that system, or the respiratory system, is the exchange of gases. We inhale oxygen from the air we breathe, delivers it to our cells, and we exhale or breathe out the carbon dioxide, which is the waste product of cellular metabolism. So human anatomy and diseases are usually learned in relationship to the body systems, and then we'll learn the diseases that affect these body systems. And the main portion of this text is organized by body system. So we're going to cover the integumentary system, the musculoskeletal system, the nervous system, special senses, so the eyes and the ears, the endocrine system, glands and hormones, blood and immune system. The cardiovascular and lymph system includes the heart, blood vessels, and lymphatic systems. The respiratory system, so lung and air passages like I just discussed. The digestive system, so stomach, intestines, and related organs. The urinary system, kidneys, ureter, bladder, and urethra, male reproductive, and the female reproductive systems. We're going to learn a lot about medical specialists, focusing on different body systems in each of the chapters. So, for example, dermatologists diagnose and treat skin conditions, orthopedists diagnose and treat conditions of the musculoskeletal system, neurologists diagnose and treat conditions of the nervous system, and endocrinologists diagnose and treat conditions of the endocrine system. So, very important. I'm going to ask you these questions. They're going to come up on the quizzes and on the midterms and finals. So let's wrap this up. There are many terms used to describe body structures, to show the levels of organization, and to indicate color. And the body is divided by body cavities, abdominopelvic regions, and abdominopelvic quadrants. So very important to learn each of those, and then all of the names of the sections within each of those areas. We need to orient the human body, so to do that, so when we're describing where something is occurring on the human body in the medical record, we use anatomic directions, positions, and planes. And medical records, that's the reason you're learning this medical terminology. They come in many forms, and this is where we get all our information. This is how we communicate as healthcare providers. So we've looked at terminology to describe the parts of the body, and as we move forward, we're going to start looking at the body organ systems and how they all will function together for the whole body. Good luck, and study hard, finish your quizzes, do the discussion forums, practice your prep view, and we'll see you next time.